Good morning friends, I am Dr. Prathmesh Jain and I am an orthopedic surgeon who is specializing in sports medicine. Today I am talking about PRP. A PRP is a platelet rich plasma and this is a treatment which is given for many sports and orthopedic injury. Now today I am going to tell about what is PRP. Now PRP is platelet rich plasma and how we make it is we basically take your blood and we centrifuge it and we remove the red components, red blood cells and everything out of that, and we take out the supernatant. So that is the yellow part, and that is basically the platelet and the plasma. So that becomes platelet rich plasma. So this is a very rich source of growth factors, that is the growth factors, namely PDGF, that is platelet derived growth factor, TGF beta, ILGF1, ILGF2, TGF beta, VEGF, that is vascular endothelial growth factors, and many more growth factors. Now there is a long history of PRP, and PRP is used and abused for a number of orthopedic indications, and it has been marketed a lot by several pharma companies and several clinics. So you must understand that where a PRP works and where it is just a marketing gimmick. So PRP is basically a body fluid which has got healing powers. So because as I told you that platelets has got a lot of healing mediators and healing powers, so it is supposed to act in a number of conditions. So let's go to the history. So the PRP use started in 1970s when this was used for the treatment of thrombocytopenia. So when the platelets in your body decrease, then doctors used to give a PRP infusion to the patient, and it worked very well. In 1980s, it was started for maxillofacial surgeries and wounds, and it also worked well for that. And in 1990s, after that, it was started to be used for orthopedic indications and orthopedic surgery. Now, the PRP worked very well for maxillofacial indications, for hair transplant, and for cosmetic indications, for plastic surgery indications. It works fantabulously, works very nicely. But in orthopedic indication, the use of PRP has faced a lot of plus and minus. So what that means is, so there is a mixed evidence of use of PRP. So there are some studies which support the use of PRP, and there are many more studies who do not support the use of the PRP in general. So I'll just be focusing on where should be used and where it should not be used. So like I'm just discussing you different conditions like ACL injuries, so anterior cruciate ligament injuries. So no evidence of PRP injection. So if you have a ACL tear or ACL injury, there is no role of PRP injection per se. So if you are having an ACL tear, there is no role or no evidence to prove that PRP injections works well. Same is with a full thickness or a full thickness rotator cuff lesions in the shoulder. So a rotator cuff tear which is full thickness will not heal with a PRP injection. So you must understand that if there is an injury and if there are complete tears of meniscus, of ACL or rotator cuff, it will not be treated with PRP. It is not possible to treat them with PRP. So where the PRP has got some chance. So there are very restricted indications in which PRP has got some role. So specifically role in tendinopathies. So where there is an inflammation in the tendon and there is a degeneration in the tendon, in those particular indications PRP can work. So these indications are namely plantar fasciitis, tennis elbow, Achilles tendonitis, and diseases similar to that. So specifically for tendinopathy, which is in the localized area, you can use a PRP injection. A very important point that we all don't appreciate is a PRP is a healing modulator, and it will improve the healing over a period of time. So supposedly you start with a PRP therapy, you must understand that the effect of the PRP treatment will take at least 3 to 6 months to appear. It's not a magic injection that you give an injection today and the patient will be fine next day. So the PRP injections will take around 3 to 6 months to act completely. So if you want a quick relief, better to take a steroid injection as compared to a PRP injections because they work faster for control of inflammation. Similarly, because of the same reason, this is not good for an in-season athlete. So if you are an in-season athlete and your performance has deteriorated and you want to take a PRP to improve your performance immediately, it is not possible because PRP will not act acutely. It is not possible. So because of all these reasons, the PRP use is in still a controversial stage. So still, after so much of research and so much of development, it is still considered an experimental therapy. Now I'll be coming to some scientific aspects of PRP. What are the types of PRP that we have? So there are 4 major types of PRP that we have. The most commonly used PRP which is we are using in orthopedic practice is called as a PPRP, that is a pure PRP. So that is basically concentrated of platelets and it is platelet rich plasma and it's a pure platelet. So no white blood cells, no red blood cells, it is just platelets. And this has a better indications for chondrogenic differentiation and chondrogenic effect. So it's a good for orthopedic and it is a fluid also, so you can inject it. The second is called as a LPRP. LPRP is Leucocyte Rich PRP. And this is basically the buffy coat. So this has got better concentration of platelets, but it has also got the leukocytes with it. So white blood cells are also there, but it has got inferior effect on bone regeneration and regeneration because of the white blood cells which has a NF-kappa-B pathway which decreases the inflammatory response. So it's also called as the buffy coat PRP. Now the other 2 PRPs are basically PRF, so that is called as platelet rich fibrin. So they are not solutions, but they are gel-like structures. They are fibrin glue kind of a thing. So it is like a paste that you can apply. So not very useful in orthopedic conditions, but they are very good for wound healing and cosmetic surgery, maxillofacial surgery purposes. So again, it of 2 types, LPRF and PPRF. PPRF is a pure platelet rich fibrin and LPRF is leukocyte rich platelet rich fibrin. Okay, so these all the things can be used for different indications, but as I told you, PRP has got established very nicely in the treatment of maxillofacial conditions, for alopecia, hair loss and cosmetic surgery indications. It is still not that developed and the indications are not that defined as far as the orthopedic surgery is concerned. Specifically, I'll talk about osteoarthritis. So osteoarthritis, it has got some role. So the evidence suggests that in osteoarthritis per se, the role of PRP is better than hyaluronic acid. So hyaluronic acid is another injection which is given in the knee. And as compared to the hyaluronic acid, it has got little benefit effect, slightly better. So this is not a very striking difference, but it's a slightly better than hyaluronic acid. And those patients who have a diffuse cartilage lesions, diffuse osteoarthritis of the knee, mild to moderate lesions of osteoarthritis of the knee, you may use PRP with caution. Still, the results are not very much defined, results are not very much encouraging, but still it is better than a hyaluronic acid injection. So in particular subset of osteoarthritis of the knee, you may use this injection with a guarded prognosis to the patient. So it may work, it may not work. Hopefully, I have cleared all your doubts concerning the platelet rich plasma or the PRP therapy. One more thing I would like to emphasize is there are 2 major types of procurement or production of PRP. One technique is called as an open technique, in which there is a little bit of contamination with the environment, and the other technique is a closed technique. So what that essentially means is we take out the blood and the blood is run in a closed compartment without contamination from the environment. So it is a more safer technique, but it is little bit more costlier technique. So you can do the procurement of PRP either with the open technique and closed technique. Open technique has a chance of contamination, but it is little cost effective, cheaper, and the closed technique is a little bit costlier, but it has got less chances of contamination from the environment. So I hope I am able to clear all your doubts regarding PRP injections, and if you have any more doubts, you can reach back to us on the comment section. Thanks a lot.